If you've been diagnosed with peripheral neuropathy and the medications your doctor has prescribed haven't helped, or they've helped a little, but the burning, the numbness, the tingling is still there, I want you to know there's a real biological reason why these medications aren't working. And there's a real biological reason why acupuncture works for peripheral neuropathy patients when nothing else has. My name is Dr. Rebecca Gibbons. I'm a registered nurse and acupuncture physician, and I've been treating neuropathy patients for many, many years. Today, I want to explain exactly what is happening with your nerves and why acupuncture addresses the actual root cause instead of just masking the symptoms. So, what is actually happening with your nerves? Let me start with peripheral neuropathy, what peripheral neuropathy actually is, because understanding this gives you a whole new world of looking at it. Your peripheral nerves are the communication network that runs from your spinal cord out to your hands and feet and legs. Think of them like electrical wires carrying signals back and forth between your brain and your body, telling your feet where they are in space, telling your brain when something is painful or sharp or hot. When those nerves are damaged from diabetes, chemotherapy, or even unknown causes from whatever happened in your case, that communication breaks down. These signals get scrambled, and when nerve signals get scrambled, your brain interprets that as burning or numbness or tingling or that horrible pins and needles feeling that keeps you up at night. Now, here's why conventional medications often fail neuropathy patients. Most of them, like gabapentin, Lyrica, amitriptyline, they work on the brain's perception of the pain. They don't do anything to the damaged nerves themselves. They are essentially turning down the volume on the signal without fixing the broken wire. That's why so many of my patients come to me after years on medication saying, I'm still in pain, the symptoms are getting worse, I'm just foggy-headed, exhausted from the side effects of the medications. The medication was never designed to heal the nerve, it was designed to make you feel the damage less. This is where acupuncture is fundamentally different, and where my background as an RN, an acupuncture physician, helps me explain this in a way that even most doctors can't. When we place acupuncture needles in specific points along the pathways of your damaged nerves, we trigger three things that the medication simply can't. First, we increase the microcirculation. Your peripheral nerves, especially in your feet and legs, depend on tiny blood vessels called capillaries to deliver oxygen and nutrients. In neuropathy patients, that microcirculation is often severely compromised. The damaged nerves aren't getting fed. So acupuncture stimulates the release of nitric oxide and other vasodilators that open these tiny vessels back up and restore blood flow to the starving nerve tissue. You're essentially feeding the nerve again. Second thing it does is we stimulate nerve growth factor. This is the important part that people don't know. Acupuncture has been shown in multiple peer-reviewed studies to increase the blood's production of nerve growth factor, a protein that actually promotes the regeneration and repair of damaged nerve fibers. Your body has the ability to repair peripheral nerve damage. It needs the right signal to do it. Acupuncture helps to provide that signal. Third, we regulate the nervous system itself. Many neuropathy patients have a nervous system stuck in a state of hypersensitivity, constantly firing and constantly on alert. Acupuncture activates the parasympathetic nervous system, or the rest and repair mode. And it creates an internal environment where healing can actually happen because your nervous system is actually able to calm down. We are not just placing needles randomly. We are targeting specific patterns of nerve damage. And it's why patients who come to me after failing conventional treatment often experience things they were told was impossible, like feeling their feet again. So Now I want to be honest with you about what to expect, because I believe in setting realistic expectations, especially when I first talk to you in person. Most of my neuropathy patients begin to notice changes within the first 3 or 4 weeks of treatment. Typically, the first thing people notice is that the intensity of the burning or pain begins to decrease. Then gradually, sensation starts returning. Often patients describe it as their feet are waking up. The timeline varies depending on how long you've had the neuropathy, the underlying cause, and how much nerve damage has accumulated over time. Someone who has had neuropathy for 6 months responds differently than someone who has been suffering for 10 years. Makes sense? I'll be honest with you, about the realistic expectation when I meet with you. So what I can tell you is this: the patients who do best are the ones who commit to the process. Nerve regeneration takes time. We're talking about rebuilding biological tissue, not just masking the symptoms. So most patients need consistent treatment over several months to achieve meaningful, lasting improvements. But the patients who do commit, the ones who come in regularly, many of them tell me it's the first time in years they've slept through the night. They notice their balance gets better. They can walk their dog again, that they can stop dreading the moment their feet hit the floor in the morning. Those outcomes are real, and they happen because we're actually addressing what's wrong, not just quieting the alarm. So if you are living with neuropathy and you're in the Pensacola area or Panhandle area, and you've tried medications that haven't given your life back, or you haven't seen any improvement, I'd love to talk to you. You can give us our office a call to set up a consultation. You can call us at 850-530-1028, or you can check us out on our website at awpensacola.com. Have a great day.